Wonderful. So Ali is a chiropractor, amongst many other things, and you can elaborate in a second, I think. But also a long-time member of the studio. So he practiced here many times. Not so much recently, but we'll work on that. But
World Cup is on.
Yeah, exactly. World Cup kind of is important. Anyway, so Ali's here today, and he's going to talk about the spine, what's going on with the spine, and its relationship with Bikram Yoga, and kind of what's happening when we're doing our postures.
Beautiful.
And, yeah. All right, so to you.
Thank you. All right, thank you all for being here. I'm a chiropractor and I'm also a clinical nutritionist. I've been in practice for just over about 15 years now. Things are exciting. Our practice is in Campbell, brand new office we opened about over 2 years ago. We've been growing really fast. The reason for that is we are very patient-centered and we help people get over their problems by custom designing structural restoration, neurological restoration, chemical nutritional restoration. And so because of that, it is very unique the way we approach the human body, and that's part of why we've been successful. To begin, human body has been designed for movement, and the most important part of movement in the human body is the movement of the spine, our backbone. For two reasons. Obviously, spine is designed for movement, but it also has a very important function, which is the protection of our nervous system. And why is nervous system important is because it's our superhighway of communication between our brain and every organ, tissue, joints, muscles. So the reason I like to practice yoga is because it creates motion at an intimal level in all joints and muscles, especially spine. And one of the most beautiful ways of doing yoga, I mean they're all great, but I love Bikram Yoga because of the 26 posture. Really takes you through a great experience of full body movement and per se neurological restoration. So today we're going to talk about some of these postures. 45 minutes not long enough for me to talk about 26 posture and elaborate on the structural and neurological effects on the human body, but we'll try to get a few of them, and I'll try to summarize so you guys get the idea about how to implement yoga into your daily life or weekly life at least, and how you can balance it with your emotional and chemical nutritional life. So when I say chemical nutritional and emotional, our philosophy in my practice is based on the triangle of stress. Now, a lot of us have heard this word, and in our society has a negative connotation. I don't think it's a bad word, and I actually think that stress is a good word. It makes us grow. And in fact, when we exercise, when we do Bikram Yoga, we stress our body so we can improve. So there's three different kinds of stress. We have physical stress, we have emotional, and we have nutritional. Okay? Now, we all experience that as soon as we're born. And how we balance it separates basically separates the healthy people from people that are not so healthy. So in the structural physical portion is that we do yoga, we get chiropractic adjustments, maybe we get acupuncture treatment and other type of exercise. Human body again was designed for movement. We have joints. The joints are attached to other type of soft tissue, namely muscles, ligaments, tendons, and those structures need to be moved. one of the major reasons why Bikram Yoga is very essential to human life today is because modern human, us, we spend a lot of time in this posture. Right? I'm exaggerating, but if you think about it, we spend a lot of time in this posture. We're driving, we're on computers, we're on cell phones, we're on iPads and laptops, right? So what the 26 postures kind of gets us away from this and intends to bring this back. And why? Because this is the reality of life. This is, even if you're not emotionally sad or depressed or down, if you put your body more than a few minutes every day in this posture, your physiology, it's gonna perceive that as sadness. So your chemical release in the body is that of sadness, right? So we're in Silicon Valley. You get a lot of people that sit behind computers all day long. And they're so focused on their tasks. You know, they are given tasks and projects and they have to fulfill them. So when your mind is focused on that, you lose track of your posture and you go into this posture. Perception of body, the chemical release is that of sadness, of being low energy. So this is one of the, if not anything else, just based on that point, it is really important that we do exercises and programs like Bikram Yoga. Why? Because it allows us to kind of come back to this. Now, during the 26 postures, there's a lot of us have been practicing for years, right? And we're still trying to get better at some of these postures. And sometimes in certain postures, when we make ourselves vulnerable, because we practice this so much, body doesn't like it. It's like, oh, this is a huge sudden change. So you gotta be patient and you gotta keep at it. And you gotta meditate and you gotta fuel the body, right? In terms of fuel, basic fuel for Bikram Yoga, because we sweat a lot, we use a lot of electrolytes, hydration electrolytes, right? Electrolytes are basically the charges, the electrical charges that we get from minerals. And we get that through mainly hydration and water, and then some fruits, vegetables, and other kind of foods. So we have to replenish. Muscles and organs are connected or have presentations in, rather, different organs have different presentations in different muscles, right? So if an organ or system is not working efficiently, certain muscles could become tighter, right? How many people have suffered shoulder problems in the past? Okay, who knows what organ that's shoulder connected?
Spine up here.
Sure. What organ? You're close to it, you're pointing to it.
Oh,
You have two of them.
Heart,
Lungs.
lungs.
Lungs. So our shoulder and serratus anterior muscles are our lung muscle. Okay? Now if you go in this posture, what are we doing to those muscles?
Contracting.
Stressing them? Yeah. So what's going to happen to our lungs? They're going to shrink. They're not going to be fully expandable. Right? So right there, huge challenge. Is our quality of life optimal in that point? No. So now suddenly, if we practice this over and over and over, then it goes to the next muscle groups, which are the hip flexors now. Now we're contracting here, now we're going here. We have patients over and over again. They've been to different chiropractic clinics, acupuncture clinics, orthopedic surgeons, cortisone injections, shoulder problem, four shoulder problems, frozen shoulder. When they come to us, we realize, well, we can release the tension of the shoulder. But soon after, if the problem continues or returns, we follow the chain, it's always hip flexors. And so when we release the hip flexor, the shoulder is no longer an issue. It automatically resolves, per se. So that goes to tell us the kinetic chain in the human body, the connective tissue concept. And in that connective tissue concept, we have to address all joints, all muscles, all tissues, all organs collectively. Unfortunately, in modern way of healthcare, we've been taught to ask, oh, do you have something for this? And do you have something for this? And do you have something for that? Well, it doesn't work that way. This works all together. Does that make sense?
Yep.
Based on these three concepts. They're not even concepts, it's reality, it's life. You have a physical body, a spiritual, emotional body, chemical, nutritional body. And we focus a lot on the physical body, which is great, we should. Not everybody is good in this corner in our society today. And less in this corner. A lot less people are paying attention to their emotions and their psyche. It's part of being human. All right? If you start getting into it, you can find so much, which directly will help this and that. So we have to connect all the dots, you know? So when people ask me, can you help me fix a problem? I'm like, I can guide you, but your body is gonna do it as long as you follow my guidance, because it's based on these principles. These are the pillars of life. And if you choose to do it, we're game, let's do it. I'm your coach. You get results, right? So, let's talk about some Bikram postures and why they're good, and we can break them down. I like this to be more interactive. I don't want to be like lecturing. I like to lecture. I like to help people improve their quality of life. And one of the best ways I've learned how to teach and people learn is when they ask questions and their questions are answered, and then they have a higher tendency of applying it. We're living in an age of information. To me, information without application is useless. We have a lot of information thanks to Google and Facebook, you know, Dr. Google, Nurse Facebook. No, but in reality, that's what it is. So let's make it a little more interactive. Anybody has any suggestion about which posture we should talk about? And we can bring Peter here. Peter used to be my patient. He's no, I'm just kidding. This is just a plastic model of a human spine.
We talk about the back bend.
Yes.
Back bend.
Well, we start with the back bend. Just
Very
a
good
simple
posture.
standing back bend.
Yeah.
I know I had my fair share of a challenge improving the camel. And again, it's because in modern life, in modern society, we do a lot of this. And we grew up with a lot of this. And so now we're telling the body, hey, go in this posture. And body's like, whoa, too much to handle, right? So structurally speaking, right, so what is, let's talk about the engagement of the muscles, okay? What's the most important muscle we get engaged when we extend our back?
Your hip flexors have to engage to
They have
stabilize.
to stretch, yeah.
They have to stabilize the base.
How about
Exactly.
core body muscles?
Core body, those are also good. Those there's 3 layers of muscles, okay? There's really intimal core muscles that go around the spine. There's a second layer, and then there's the big muscles that a lot of us know about, like, you know, the pec muscle or the biceps, the triceps, right? So when it comes to spine, those core muscles, and we're not going to go into the names, but those are very important. And because of our poor postures, they get weak. And they lose support in keeping stabilization, okay? And so if we do things too fast, too quickly, if we've had a life of being in poor posture, they might cramp up. And those are the back spasms we encounter here and there. To some of us, has happened during exercise, and sometimes even during the practice of Bikram Yoga. Yeah, it happens. Is that a bad thing? Not necessarily. It's a bad thing that happens, but it's also a signal telling us where we're most weak. Yeah? So we want to overcome. Another thing that's common in our society is that, oh, if it hurts, don't touch it, don't move it. I'm not of that school. I say, let's find out the root cause. while we're addressing the root cause to overcome the challenge, we want to make it mobile. We want to make it move. Otherwise, it's just gonna get worse. Does that make sense?
Yes. Yes.
I get almost every day patients coming in, like I walk 2 blocks, my knee starts to hurt, I've stopped walking. I'm like, well, that's not good. Let's get you walking. But what's the challenge of the threshold of 2 blocks? Does that make sense?
Yeah.
So what's in practice of yoga, we all have our threshold. It's all about threshold. Everything is in life is about threshold. We want to overcome that threshold. So sometimes we have to find that threshold. Some of us know, especially those of us that are been doing this for a long time. Some of us, we still don't know. We still have to keep going until we find it. Mm-hmm. Now, that doesn't mean we don't have lower thresholds. We still have to overcome those. But there's a higher threshold where the body kind of stops, and we know where that is at any given point, and we want to overcome it. Do you have a question?
Yeah, so that person with the knee problem, how do you trace back now? Because it's probably not the knee, right? It's somewhere else. How do you start about going?
Oh, you want to go there?
We need to figure out what's the root.
Definitely. That's a great question. So based on this triangle, obviously we do a thorough structural examination to find out if there's indications of structural instability. First and foremost, in the case of the knee, everything about the knee, the muscles, the joint itself, the kneecap, muscles attached, the ligaments attached, and also the tendons. So we examine all of that. If there is any indications, well, definitely we're going to address the structural component. In the emotional component, in Chinese medicine, and I reference Chinese medicine because it's a type of Eastern medicine that most North Americans can relate to, or at least know a little bit of. Mm-hmm. But it's not limited to that ancient culture. There's other cultures around the world that's been doing this. But in Chinese medicine, knee problems are taking a step into future. So you're having an uncertainty about your future. So there's an emotional component there. When it comes to nutrition, again, through different methods, including but not limited to Chinese medicine and acupuncture, knee problems are gallbladder and liver issues. So then as a clinical nutritionist, I also want to find out if they have any indication of liver or gallbladder. So we address the structural, the emotional, and the chemical nutritional. Does that make sense?
Yeah.
All right. You're welcome. So that's the way by which we can approach the body, because it's not always a structural. And that's why those people that go for the same shoulder problem over and over to multiple disciplines and still don't find problems, or for the same knee problem over and over a span of years, and these joints unfortunately continue being deteriorating, especially with the administration of cortisone, because cortisone, it deteriorates cartilaginous material, then it continues to be more and more arthritic. Are we really helping it in the long run? Probably not. We might reduce the symptoms temporarily, but we're not going to resolve it. Does that make sense? So we always want to address the other causes.
So getting a cortisone shot is really it's harmful to the tissues?
Yeah, studies show that 3 or more administration of cortisone injections, it's going to destroy your joints, predominantly the hip joint, to the point that eventually the joint is fully destroyed. And because of that, we have a lot of professional athletes in their 40s and 50s and 60s that end up having hip replacements and knee replacements.
Okay.
Yeah.
Yeah.
Okay. Yes?
3 total or 3 with that time frame?
3.
I don't know the answer to that. I have to go back and read the study. I think, well, this is the thing. Even for cortisone to be effective, we need a lot of minerals in the body. Selenium is one of them.
Right.
it needs to be converted to cortisol, so even the medication can be effective. Now, it happens that a lot of people who are in pain and they're malnourished, they don't even have the sufficient amount of minerals in their body for the medication to take effect and work properly. Could that accelerate the degeneration process? Probably. So I'm not sure if it's over in the short. I think it's in the lifespan. Yeah, I think that's what it intended to say, that study. But regardless, we gotta address all the needs. And so even sometimes when people are in severe pain, and with my patients that we co-manage with some colleagues that administer an injection, we make sure that this is addressed, that they have enough mineralization for the medication to take effect. And that's not the only medication. A good array of medications do need to have sufficient amount of different types of vitamins and minerals for them to actually work. And so that's something for everybody to think about. And unfortunately, many medical doctors are not trained in the nutritional aspect of things as vast as a nutritionist would be. So if they work closely with a nutritionist, the patient will be better helped, even for the short-term relief. And that's why cortisone, as use cortisone as an example, is that people sometimes say it didn't even work. Possibly they didn't have enough minerals in their body for it to convert to the functional form so the body can use. Does that make sense?
Yeah.
So when we do a back extension, we need stabilization. There is upper body stabilization and lower body stabilization. Some of that, as humans, we are superior in the animal kingdom because of our paraspinal muscles that run along our spine from our head to the base of our sacrum, and also our calf muscles. Those are the muscles that keep us upright. True? And so they are always engaged and working, right? Especially when we're standing. That's why we need to sleep. That's one of the main reasons. That's one of the main reasons that many cultures around the world take siestas. They lie down, they rest it. Two things happen. Those muscles relax, and these discs are in large part water. There's a process called imbibition, which is rehydration of the disc. So when you lie down, you allow water to go back in. For that matter, if you measure yourself first thing in the morning, you're a little taller. A millimeter or two. Question?
That's why we have so many savasanas during the practice.
Exactly. So you need to rehydrate and rest the muscles and the spine as well.
And that's why we
that's
should
yeah,
stay in savasana after practice for a long time.
Long time, exactly. One of the major reasons.
Can that happen in 20 seconds in between postures?
It does help. It does help.
It does.
Yeah. You know, the more. So the other component of it, well, there's so many different factors. So that's one. The other component of it is we have or a couple of them organs called adrenal glands, right? Adrenal glands are little hats that sit on top of kidneys on both sides. Now, what's their job? Their job, one of the major what they do, they produce a lot of very important hormones, but one of the important hormones is cortisol. And what's the job of cortisol? To manage stress. Mm-hmm. And if we live in a stressful posture, lifestyle, poor quality nutrients, no mental support in terms of meditation, release, right? What's going to happen? The cortisol is going to be higher than what it's supposed to be. What's going to happen? Our adrenals going to be stressed. So now we're going to have adrenal fatigue to the point that you can have 5 cups of coffee, no effect. And that happens in our society a lot because it's a deeper problem, right? So adrenals, basically, we can reduce the stress on adrenals by laying flat. That's all you got to do. You know, it doesn't have to be next to the beach or at the beach, you know.
Although that helps.
Does help because we got the negative ion from the waves. Beautiful environment, you know, or it can be in a forest. That's the benefit of being in those environments. But laying down, that's another benefit of reducing the physical stress on the human body, so the adrenals go, okay, I can manage this. So that's why a lot of societies do siestas. Another reason why they do siestas, except us in North America, all right? Because America runs on. Oh, sorry, you're recording. Question?
No, are we getting to the back bend and then the
Yeah. So
what's happening?
So so I kind of digress here,
Okay.
but we're getting to the point. So when we extending backwards, we're making our bodies vulnerable, right? And one of the things that adrenals do is when we're laying down, okay, we don't need that much of adrenal function. Their job triggers when we go upright. So what do we do in Bikram Yoga? We do a lot of this.
Right.
Okay, especially in the first half, right? So that why they are important is because the adrenals, when we go from here to here, gravity is not pulling so much on the heart, but when we go here, now gravity is pulling on heart. So the job of balancing our heart rate falls back onto the adrenals. So the adrenals have to kick in, so when we go upright, our blood pressure doesn't go up too much, and it's steady. Make sense? So if we practice this, we can become good at it. Those of us that are not good at it, we lie down, we get up, it's like, whoa, it takes us a few seconds. And some people are so bad, there's a thing called syncope, lack of blood flow to the brain for a few instances, and people pass out. Happens a lot with elderly because they're not as mobile, they're not nutritionally fed. The fact of sitting down and getting up, they go like, oh, I have to balance this. So that's another benefit of Bikram Yoga, because we go from here to here. Now, when we go back bend, what's going to happen? Do we usually do this? No. We're making ourselves vulnerable to the world. What are the adrenals going to say? They have to adjust, right? So they have to gear in to hold our balance in relation to our heart, right? So that's the chemistry. Now, if we're standing and doing that, now we have our legs, and we have to balance on the legs. So that's our foundation. But if you're doing the camel, we're on our knees.
Right.
And that's definitely even less common for us, because who kneels down and bends backwards every day? But it's a great thing to do, because we're so above many individuals in our society. We're better ready for fight or flight. And the reason I'm saying that, practicing routines like Bikram Yoga gets us ready for fight or flight, is that in our society, people are so stressed, the slightest thing that happens, it throws them off, like a car accident. Hearing bad news, yeah, it throws them off, because their adrenals are not ready, their heart is not ready, their minds are not ready. But the fact that we practice and move the body, we challenge it, we stimulate balance of adrenals in relationship to our heart, to our muscles, to our joints. God forbid something bad happens, or a sudden news or whatever, the body's like, okay, I got this, I can handle this.
Bikram has a particular way of describing this when he talks about this exact phenomena, which is, he talks about, he has a long way of explaining, but the short version of what he says is bulletproof. That you bulletproof across all the dimensions.
Yeah.
So you're bulletproof in your body, you're bulletproof in your mind, you're bulletproof in your spirit.
Yeah.
You can deal with anything.
Yeah.
And that's a nice simple way to put it. Bulletproof.
Thanks for sharing that. That's all there is to it. All of this, what I do, what Bikram has put together, is to improve human quality of life. That's all there is to it. And the point is that, what's the difference between someone that climbs Mount Everest? They're human too.
Yeah.
They have the similar kind of tissues that you and I have. All they did, they trained it so it was better ready to go to one of the toughest atmospheres on Earth and still thrive. Not survive, but thrive. Does that make sense? Yeah. So that's I think that's one of the biggest things to talk about, making our bodies open to the outside world, hey, I'm ready, bring it on. Challenging. Sometimes you feel that nausea.
It goes back to what you said earlier about
Yeah.
stress. You know,
Yeah.
stress is a positive force in life.
It is.
Yeah, you're using the stress to make you bulletproof. You're using the stress in your training to climb Mount Everest.
Exactly.
Yeah.
Yeah. And so for those of us that don't have the facility to go climb Mount Everest, we have this facility and we can practice Bikram Yoga. The more, the better, as long as you address the emotional component and especially the nutritional component. You see? Now, there are going to be challenges. I've had patients or individuals that have been practicing and they come up with challenges like, well, you know, I cannot go past this posture because I feel like this part of my body, this joint is locked. Sure, no problem. That's a challenge that you work up to. Let's find out what is hindering it, overcome it so you can get better.
I have a friend who did Bikram Yoga, and he said that his lower back, like where, like kind of the beginning of the spine, a little bit higher, just started hurting. He weightlifts, so I was wondering, like, and then you know, every time he would go to yoga, it would hurt. So
Right.
what would be his, I guess, the answer to that?
Yeah, so a lot of us learn, like let's say weight training, by watching others. And nowadays we have YouTube. So we watch videos on YouTube and we go copy that and try to replicate it. And it's not always appropriately done. So maybe to begin with is their posture, their form in training. Same goes with Bikram Yoga. That's why we have these wonderful instructors, our teachers, that verbalize and guide us through it. That's very important. For that, we have to calm our mind and emotions so our ears can open. That is the practice. And so we can hear and we can correct over and over and over. So that's form, right? Now let's say this person might have had other issues from the past. Maybe this person played football or soccer in high school or college and they got hit. While the body overcame the pain and the inflammation, maybe structurally it was never restored. That's someone that could use a chiropractor to examine the problem, see if there is any need for specific restoration before they can continue. So that would be overcoming that challenge, right? Same thing. So first is form, second is finding out if there is underlying issues. Other things that they can do is, are we addressing all our nutritional needs? Are we eating in quality, quantity, and frequency? That's also very important. Are we having good fats, good proteins, good carbs in each meal and snack throughout the day in 5 to 6 servings? That's also very important. When you practice Bikram, you're demanding a lot from your body, physically, emotionally, and nutritionally. You better fuel right. If you have the same fueling habits as you did before you commenced Bikram Yoga, your body is going to let you know. In form of pain and discomfort in many places. Go there and then.
Can we look at the standing back bend
Okay.
and talk about different aspects of how it's therapeutic? So we
Okay.
talked about the adrenals,
Right.
but also about the muscles, the nerves, how
Okay.
that impacts the spine itself.
Sure,
Yeah.
that's a good question. So when so now let's just talk about the physical. I think that's what you're asking.
Yeah.
Okay. So in the spine, basically we have intimal muscles that are our core muscles. You've heard about core stabilization exercises. So that's a great core stabilization exercise. Why? Because the muscles around the spine also need training, right? So when we squeeze them, okay, and that goes with every posture, by the way. What's one of the major, structurally speaking, not the emotional component, but structurally speaking, what's one of the most benefits of doing yoga?
Squeeze and release.
Squeeze and release. What happens when we do that?
Circulation,
Exactly.
So
Why is circulation so important?
nutrients, oxygen,
Nutrients arriving to
and
destination
waste as well.
and elimination of waste.
Oh, yeah.
Great. That's all there is to it. So again, if we're not training those muscles, that level of circulation and elimination is not going to happen efficiently. And because a lot of us are sitting, so when we sit, all the weight is distributed mostly about these two joints, vertebrae and lower spine. Does that make sense?
Yeah.
When we stand, in addition to here, the weight spreads in both legs. So less stress when we stand and walk. Now, when we do this, we're opening up all these muscles in the front that have been tight. The abdominals, the hip flexors, chest muscles. How great is that? It's lovely. It's hard at times, right? When we haven't done it in a long time, myself included. And so, and then when you go back, you feel it. Your body's like, whoa, you know? Like, okay, take it easy. Go to your limit, threshold, and then build up. And so the abdominal muscles open, the chest muscles open. Now, head is a heavy piece of equipment. Yeah?
Yeah.
So that's gonna be hanging
Yeah.
on top of this huge rope.
Right.
Now, the beauty of the human spine is it's a hydraulic system. For those of you engineers, what's a hydraulic system? It's an enclosed system where the pressure is evenly distributed.
Right.
In fact, when the chiropractic adjustment is performed, some of you might have had chiropractic adjustment, that popping releases nitrogen gas in the joints. But another thing it does, in this hydraulic closed system, it redistributes the force evenly all throughout the body.
Oh yeah.
That's a huge part of chiropractic adjustments and the effect it has. So distribution of energy throughout the neurological body. Yeah? We do that with Bikram postures. So we do this at the spinal cord level, that's what happens. Now some of us might, sometimes we also hear a popping sound or two.
I do.
Whether we go forward or backward, there is a release. So you're self-chiropracticing.
Yeah, that's what I was gonna say, that I get sounds when I'm doing the spinal twist
Right.
or any bends, or
Yeah.
I'll get hops and things like that.
Right. So that the popping sound is a release of nitrogen gas from inside your joints.
Wow.
Whether you do it or a chiropractor does it. Now, through chiropractic, we have to investigate to see, because some individuals have severe, huge blockages. And many people might not be able to do it on their own. Sometimes it's not even, bodies unable to do it with even exercise, including Bikram. So it has to be done professionally with what we call a high velocity, low amplitude force for that to release.
Wow.
And that's done by a skillful chiropractor, and that's what we do. And so when that release comes, you'll see that joy in people's face on the table go, oh. That is that restoration. And that distributes throughout the whole spine and throughout the whole nervous system. That's the power. Yeah, yeah.
For the standing back bend, can you explain a little bit the difference of
I'm not gonna do it right now. You're trying to get me now.
when you're bending backwards, the difference between when you're sort of collapsed into it versus when you
Yes.
stretch up and out? Because
Yes.
for me
Yes.
personally,
Good
that
question.
was the key to being able to
That's
open
a
up
good
and still be able to
question.
breathe.
Yeah, so a lot of
Extension versus crunching.
exactly.
You don't
Yeah,
want to
that's a
fall.
great question, and a lot of us started. I started Bikram about 12 or 13 years ago. At the beginning, even though I had the knowledge, the practice is a whole different ballpark. So now I understand it based on my practice and knowledge. So you don't want to collapse. This is bad. This is actually stressful to the especially last two vertebra. In fact, there's a type of fracture, but it's not really a fracture. It's more a dissociation of two bones of the vertebra. Okay, that causes a condition called Spondylolisthesis. I don't know if you spondies. So this happens a lot with athletes, young athletes that do a lot of back extensions. Okay, gymnasts, very common. All right, happens in some martial artists, but a lot of it in gymnasts in young age. And the reason why is because they push this part without stabilizing this part. These two bones, the vertebrae have no choice but to start separating back and front. That becomes a spondy. Now this could happen in adult life as well, but that's even more painful and more problematic. Many gymnasts in their later stages of life, they have a lot of problems, both men and women, mostly women. I grew up practicing gymnastics and I love it, but because I learned about it, I don't want my kids to do it. Because it's pretty bad. I mean, the consequences are not really ideal for their later stages of life, especially for women that gonna go into the childbearing age, and it's a lot of problems. So I've helped a lot of gymnasts in my practice as well. So that doesn't say that someone loves gymnastics, they should do it. Perhaps like that, too much stress. So where do we start? Imagine the body as a rope. We start here, and vertebra by vertebra, we go back. That requires listening to the instruction. If you listen carefully,
Take
that's
a
what
deep breath.
Exactly.
Full lungs, so your chest is up because you've filled your lungs, you've relaxed your neck, and you drop your head back. And the very first thing to go back is your eyes.
And that's like
Your
Yeah,
arms,
your
yeah.
eyes, your head, and then your arms starting to access
an
your
extension of
thoracic.
our
Your arms should face the ceiling, right?
right.
Well, you bring your arms back as well as possible.
Yes. as
Yeah.
far as-
So ideally, that's what you'd be doing, and you don't want to do this kind of thing.
And it's something, you know, as teachers, it's something that we look for. And it's not, stiff people don't have that problem. Stiff people are not going to crunch into the lower back because they just can't bend enough to
Yeah.
do that.
Yeah.
It's super bendy people, it's super flexible people
Yeah.
that can do that.
Yeah.
Yeah.
But maybe often super bendy people are also often have underdeveloped muscles.
Right.
So then they can bend, but they don't have the muscular structural support
Right.
to do what they've just done, and then it's harmful or
Exactly.
hazardous.
And those things can't feel any pain. So, you know, we were talking about that earlier, the proprioceptors are not necessarily there, you know, a flexible person will go back.
Right.
And they'll enjoy it.
Yeah.
I
So
used to do that in the beginning, I used to right back, runners class.
I know. Yeah, a lot of people do that. Yeah. Go ahead.
Yeah. Me.
Yeah.
So I have a quick question. I started Bikram Yoga like about 1 year ago, and like 2 months ago when I chatted with my coworker, she started yoga in another studio, up to Lawrence somewhere.
Yeah.
So she said when she woke up in the morning, her fingers are kind of numb.
No.
No.
Yeah. So then recently I feel same way, especially these 2 fingers.
Okay.
So do you know what happened?
Yeah, so that's the base of your neck, and in some of the postures, you're stressing that area. You probably did have some earlier issues from poor posture, and now with practice of Bikram Yoga, you're opening all of those muscles and the vertebra in the base of the neck, and these nerves come down and they go into arm, and this is basically your cervical number 6 and 7 nerve that goes into these 2 fingers, and so these 2 fingers, and then the lower ones, exactly. So I don't know your past, depending on your line of work and stress level.
Well, we are accountant. We have the.
So
we
you're
have
sitting all day.
people
Yeah.
Work on the computer. Yeah. Work
They should.
all day from morning.
All day, yes. So it's a good thing that you started to make changes to that area through Bikram Yoga.
So this is the indication in the progress of getting healed.
Yes.
Possibly, yes. Yeah. If you continue to have the problem and it starts to get worse, and
It's
after,
actually getting better.
okay, good. So if that's the case,
3
you're
weeks ago was so painful. First of all, I feel a lot of pain here. And one day when I do this posture, I feel lump from here to my fingers, then my back pain went away right away. Then my 2 fingers started to get lump.
Yeah.
Now it's getting better and better.
So you brought it to your nervous system's attention, and through your practice, because you didn't give up, you didn't give up,
No.
you overcoming that challenge, and that's beautiful.
Wow.
Okay.
Really?
Great testament. Yeah.
That's very
Sure.
I have a question about
Sure.
that.
Yeah. On the one day
So,
class,
so-
this one.
Yeah, there's
Remember
one thing
that
I want
posture?
to reinforce just from what you said,
Yeah, I
Ali
feel
said.
the normal.
Yeah, is the key thing is what happened to you is exactly what Bikram Yoga is about. You know that, and you get into areas, as Ali was saying, there's some underlying cause, and you start to open up those. But there's a very important point here, which is if it doesn't go away, or if it gets worse and worse and worse, there is a point at which, in the first instance, talk to your teacher, and then if it's progressive, then you should seek professional advice. But you know, always start with the teacher. But if it's just a matter of a few weeks and then it starts to get better, that's quite normal. That's very, very normal. Same happens in other areas of the body with knees and lower back pain. I mean, you mentioned lower back pain. I mean, if I had $1 for every beginner who experiences lower back discomfort doing Bikram Yoga, I literally would be a millionaire. It's the most common thing in the world. You know, the first sort of 8 to 12 weeks, oh, my back's got worse.
You know, one of the common postures that does that is the sit-ups.
Yeah.
People who have poor core,
Yeah.
and so you may not want to do the sit-ups if it's your first week, second week, or third week. And maybe go to your side and gradually get up, give time to the spinal core muscles to start building up, and then eventually build the muscles so you can easily do the sit-ups. Now, why? Because from the get-go, we're gonna start putting pressure in this lower part, and for a lot of us, we sit a lot, and so the spine is not gonna be happy, and the muscles around it is not gonna be happy, so it's gonna create some natural instability. And then you're just gonna lie down, you relax it, and the next thing you know, you go, phew, you know, and the body's like, whoa, what are you doing? And so you gotta kind of listen, you gotta tune in, listen to the instructors and tune in and stay in tune. Yes.
I have a question. So when we do the camel, it says that it releases emotional energy, we get emotion after that. So I'm just wondering, like, what's the connection between the spine when we do the camel and the emotional part of it?
That's a great question. Yeah, it's a great question. So a lot of us might experience, I'll get to you in a moment to answer this question. So a lot of us have a challenge, and that's what I was explaining earlier, is that we spend a lot of time like this, you know. If you're a mother, this is your nourishing posture, but it's a stressing. But then, if for those of us that don't have young children, is the computer work, is the driving long distances, is sitting on a laptop or an iPad for too long, being on the cell phone all day long. You know what I mean? We have a new condition now. It's officially a new condition. It's called text neck. And text neck is this. So human neck should have what we call a lordosis, which is the arch that goes this way. So I'm standing like this, so you have an arch like that. So because you're looking down so much, now people have a straight neck or even a reverse arch. That's called text neck. And we're seeing this in young adults and even children nowadays because they're spending too much time in this posture. So again, when you're in that posture, even if you're not sad, the chemical release in your body is of that of sadness. Okay? Now, on top of that, we might have experienced emotional challenges growing up based on how we were raised, the cities, countries, families, and societies we were brought up, that we might have connected certain of these emotional components to a physical component in our body. Yeah? So this is that of self-protection. I want to be protected. Now we say do this. We're opening up these emotions. It doesn't happen always at the conscious level. It doesn't. But if we consciously practice it, the subconscious starts filtering. And sometimes it happens at the unconscious level, and those are the nightmares. While nightmares could be an indication of toxicity in the body, including liver, but sometimes it's elimination. So we shouldn't freak out about it. So we're doing this, and the body's like, okay, I gotta do something with this. These things came up, they're at surface. You go to bed, brain's still working on it. That's the most filtration when you sleep, right? So, did I answer your question? Yeah, all of that is happening. Okay, question over there.
Can you talk about the scoliosis?
Oh, great question. Yes. So scoliosis is, if you're looking at the spine from the front, basically when the spine goes something like this. Now we have minor scoliosis, which is something like that. That could be just muscle spasm, poor posture. On that note, let's talk about the important posture, half moon. Why half moon is so important? And why do a lot of us have problems with it? It pulls on a very, very important muscle. Can you guys think of the muscle? Exactly. So QL muscle, quadratus lumborum, are two muscles on each, one muscle on each side. We have two of them. So it attaches from the iliac crest, which is the top of the pelvis up here, and it goes all the way to the base of our ribs. What's its job? It's also a stabilizer, but also does this. Okay? So if I'm sitting too long with a hunch over posture, what are these guys doing? These are muscles are fight or flight. This muscle right here is called sternocleidomastoid, SCM. This muscle right here. When the bear chases us, what muscles are we supposed to use to run away? We need to stabilize the spine, and we have to gear in all the muscles that make us run really fast. So if our body is perceiving, our psyche, our mind is perceiving our body of sadness, it's a form of stress and fight or flight, if you will. That's why a lot of people gather their stress in the neck area, because we have also this muscle along with the scalene muscle, which are auxiliary muscle for breathing. We're only supposed to use it when we're running. But a lot of patients come to us and they have it rock solid and they're not moving. Why? Because they're like this. So if you're not stressed physically, or you're not typically running from danger, but if you're sitting in the posture of danger, you're gonna use the muscles of danger. And those muscles over time get tighter and tighter and tighter. And sometimes with the slightest move, it goes in a deep spasm. And those are patients that walk in or are brought in. Yeah? So in the QL muscle, they're stabilizers, and we do the half moon to open them up. That's the beauty of half moon. I really like that posture.
So the half moon is good for scoliosis.
It definitely could help with the scoliosis. Now, to date, we still don't know what's the root cause of scoliosis. There's a lot of hypotheses that have been studied on. It happens more in women than men. And it's more what we call left scoliosis. So if I'm standing like this, the arch is to the left. This is a left scoliosis. The hypothesis is that women are more emotional and more right brain. So right brain stimulates the left side of the body. So these muscles become tighter than the right. Those women that have a higher tendency of being more right brain tend to have this. But it hasn't been really proven in the study, but it kind of makes sense, since we have more episodes of women, especially young girls, right? So there's two types of scoliosis. There's functional scoliosis, there's structural scoliosis. Structural is what we're born with. Some individuals are born with conditions like hemivertebra. This vertebra, instead of being nice and square, it's in the form of a triangle. During the embryological stage, it didn't form properly. That's why folic acid is very important during the first trimester, as an example. It's one of the nutrients that's very important. So we want it to form fully. So what happens is that that's a structural. There's nothing we can do about it. If it's there, it still can be helped. I've helped a lot of structural scoliosis. In fact, I've helped revert. By the way, did you guys know that scoliosis can be reversed?
Structural.
Structural, even structural. Yeah, we can minimize it. Maybe not the hemivertebra, but we can minimize it significantly.
Minimize its effect.
Yes, there's exercises and chiropractic treatments that can, now, the other kind is functional. Most functionals can be reversed.
Yes.
And so we do this kind of x-rays. So the patient comes in, we'll shoot a direct x-ray and we measure the angle. And if it's in this angle, then I want to stress it. So I'm like, bend to your right, and then I shoot an x-ray like this. Then I measure it. So the body can go from here to here. That difference is how much the body can improve. Usually within a year, with our treatment and the specific exercise we instruct the individuals. The younger, the better, obviously. So
On the scoliosis, I saw an amazing picture of a studio on the East Coast, and it was a gentleman. It was a slightly older gentleman, so it was unusual. The gentleman, I think, was in his 50s, and he had a severe lateral scoliosis to the side. It was you could see his spine from the back, and it was offset by a good 1.5 to 2 inch offset in the spine. So very, very visible. You couldn't miss it in a heartbeat. And that's what he looked like before the class. And after the class, his spine is straight.
Yeah.
Now, he's working on it, so each day he comes, it's gradually reforming. He's getting to keep a little bit more of the straightening each time. But it's amazing that that shows you what's happening to all your muscles when you do Rectum Yoga, that even just the single class is enough to restore the balance of the muscles temporarily. Incredible.
And that repetition will retrain the body to saying, hey, this is no longer normal, you gotta go in here. So we do these exercises that actually pushes the arch back into, or the scoliosis back into being aligned.
And also another Bikram thing, which is you reset your 0 on the clock, 24 hours, you come back, do it again.
Right.
And of course in that time there's also the progressive that you're training the body, as you say.
Exactly, because some cells in the human body are completely renewed within a couple days, and some goes as long as 7, 6, 8 months. So technically, when you practice changing your emotional body, nutritional and physical body, you can restore to be a brand new human being.
Exactly.
If you choose to. It's all in your power. Human body is very intelligent, has enough intelligence to do all these restorations, as long as we give it what it needs. Structurally, chemical, nutritionally, emotionally, then we can get results. So it's an hour now. I'm gonna take a couple more questions and we're gonna wrap it up. Go ahead.
Okay, well, I'm just thinking right now, because you said when we were sleeping, you remember the adrenal gland that you were talking about, that gets rested, and then when we are working all day, majority of us we work on computers and how we are slouched and all of that. Is there like a good time to practice Bikram Yoga? Like an efficient, no, not a good time, but a more efficient time, I should say, like to practice yoga. Maybe is evening better than morning? Because we are like always slouching and then we are kind of releasing all of that, versus like in the night we are sleeping and then when we come in early in the morning at 5:30.
That's a great question. So generally speaking, metabolically, it's best to exercise early in the morning because of natural higher cortisol levels. No matter what kind of exercise, including Bikram Yoga. But realistically, we have to look at our schedule. We're all busy. We're parents, we have jobs, and then the Bikram Yoga is 90 minutes, and it takes at least 30 minutes to get here, 30 minutes to go. As long as you're doing it, you know what I mean? As long as you're doing it. Now, if it wires you up so much that you are unable to sleep, if you come to an 8:30 class, you may want to think about doing an earlier class, yes. And that really, you will find out for yourself, because everybody's different. Someone can drink a cup of coffee and have a deep sleep, and someone, if you drink coffee after 2 p.m., they're all wired up at night and they cannot sleep. So it depends on the person and your schedule. Ideally, morning sessions are best. But having said that, because as soon after you're waking up, your joints are a lot stiffer too. That's why most of you have experienced that your later classes are you can do more with your joints than early morning classes.
There's one thing just on that note, you say about working and getting stiff and computer. So I used to work in high tech, so I came into this originally for stress relief. And one thing that I started to do once I started in the Bikram Yoga was I would stand up once an hour if I could remember, or perhaps a little bit more frequently when I was feeling it, something like, and all I would do is an inch or two, a little bit forward.
That changes your perception during the day.
And then just sit down, and that's it. And it takes 30 seconds. And like I said, you stretched everything out a little bit. And it helps. It really does help.
The other exercise I tell my patients, because not everybody can, or I wish everybody came and practice yoga, life would be a lot better in our communities. But people can't, or they're unable to for whatever reason. So the simple exercise for a lot of techies in the area, what I tell them to do is every hour, 30 seconds of this.
Yeah.
Yes.
Yeah.
Oh, yeah.
Now, if you want to do more, you can do what Matt showed. But what are you telling your body? It's like, I've been doing this for an hour. Hey, happiness. And sometimes I tell people, especially people who have some emotional disturbances, I say, put a fake grin on your face. There's no way your chemistry is not going to change. It does change. Your mood changes. And so those are the simple exercises you can do if you're forced to sit in front of the computer for long hours every day.
It really does work. I used to do that when I was in high tech. Drive to work with a grin on my face, and I'd get there, I'd be in a good mood. So,
Yeah, it does work. It does work. Yeah, we got to get ourselves out of
Fake it again.
the moment of the stress and whatever is going on in our mind. So if we train our bodies with this type of cues and repeat them, it becomes second nature, and life becomes better, not only for us, but everybody around us as well. All right?
Can scoliosis be corrected for somebody that's in their 60s?
Yes. Yeah.
Oh.
It could be reduced. It all depends. We have to examine them and see what's the level, the angle, do the stressed x-rays, kind of see how much body has the capability. But yeah, the answer is, again, human body has enough intelligence at any age to restore and correct all conditions as long as the tissues are still alive.
In other words, never too old, never too sick, never too late.
There you go. It's well said. Thank you, Bikram. One last question.
I know Bikram
Can you
Yoga.
talk a little bit about the ranges of motion in the spinal areas? So like, cervical, as we get better at bringing our chin up, and then in the lumbar, you can overdo it, but then thoracic feels like a big, solid mass of ice.
Right. Yeah. So one of the postures, and it's early in the practice. You go down and you bring your head to your knees. That's a natural stretch in some ways. But it's also really powerful when it comes to thoracic is to release your chest, but also your lung tissue. Okay? So when we grab and go down, what's the muscle that you use a lot to pull down?
Shoulders, arms.
Shoulders. What are shoulders supposed to do?
Open the lungs.
Exactly. So when you open your lungs, the tissues, the fascia, are you guys familiar with the term fascia?
Yes.
Fascia is what holds us together, muscles together. So when we pull, then there is neurological connectivity among the fascia and muscles and all tissue. When they open up, it releases the organ